COVID-19, the new rules in effect, it seems like almost every hour, handling the information and following the suggestions can be stressful and risky. Joining us to help us understand how we can best navigate the situation and beat the coronavirus is risk behavior scientist and pandemic specialist, Dr. Shatha Chakrabarty of the EcoHealth Alliance Leadership Council. Doctor, thanks so much for being here with us.
Thank you for having me.
We'll love to ask you, a lot of people are asking, when are we going to get a vaccine? We saw the first human trials start yesterday with Jennifer Haller in Washington State. But I would love for you to break it down for us. What's the actual process of a vaccine? We saw human testing go into effect pretty rapidly, but will we see a vaccine as rapidly?
Yes, so it's really good news that the trials have started, but that doesn't mean that it's going to be available to the widespread public for some time, and there's good reason for that. Fast-tracking any class of drugs requires real cost-benefit analysis to ensure that that drug is not going to cause more harm than good. The last thing we want is for a vaccine to get out there and make the situation worse or to add more harm to the already strained public health care system that we're facing with this outbreak. So it's really important that three things are looked at as a drug is tested, and that is efficacy, tolerability, and safety. And so there's phases that these vaccines need to go through before we can be sure that those three measures are hit and that the drug will be safe to then roll out to the public. It could take a year, it could take 18 months. Be assured that the professionals behind the scenes are working as fast as possible to get these really life-saving therapies out there, because we need to improve susceptibility or reduce susceptibility to this virus. But again, we don't want more harm than benefit.
It's interesting that you say that, though, because I hear a lot of politicians talking about that they need to focus on the vaccine. And you're pointing out correctly that these vaccines can't get rushed to market. So what should politicians be focused on? What should these folks on Capitol Hill and the rest of government, what should their focus be? Because it's going to take a while for this vaccine.
And that's a great question, and that's exactly what we should be drawing attention to, is fortifying the public healthcare system. We know that people are going to get sick. We can predict, based on the numbers of transmissibility and mortality, more or less the spectrum of what to expect in terms of how the healthcare system is going to respond to the numbers and deal with the spectrum of infections from mild to severe. Based on that, that's enough knowledge right then and there to really fortify the system. Let's get those on the front lines the resources that they need. Let's get them the therapeutics. Let's get them the hardware and the software, like the ventilators. We can create some private-public collaborations now and really just get the materials that are needed to those at the front lines that are dealing with this. Because even with all of our social distancing efforts, the benefit is likely to be marginal, and the people that will get sick and die from this will probably not be affected that much, in which case let's help those that we know are going to get sick and we know are going to be in that critical care unit.
Can you speak at all today yesterday? China came out and said that they have a treatment in Afghan or T705, that this was a real treatment that they were using and saw testing. Do you know anything about that? Is that real?
I think we need to take any sort of information coming out of some of these different epicenters where the virus first emerged with a grain of salt and be hopeful and be on top of the information, but also recognize that there's a lot of misinformation out there and we don't necessarily know the sources of information, especially when we're dealing with some governments that we don't necessarily always have the best open communication with. I would trust what is coming from the CDC and the World Health Organization and the relationship that they have forged and formed. The World Health Organization is on the ground at a lot of these epicenters, and so if information is being funneled through them, then let's take that more seriously. But regardless, we're not going to be able to justify in the free Western world putting medical devices or therapeutics out there until we have had our hand at testing them. Because no class of drugs, think about your average prescription drug, would ever be allowed to roll out without really ensuring that it is not doing more harm than good. In the same way, any solutions, especially if they're not emerging from the United States, need to really be tested for safety, efficacy, and tolerance.
So you've looked at diseases in the past, these outbreaks, whether it's SARS or MERS. I know it's still early in this, but what have we learned so far about how to address these kind of pandemics? What have we learned about how to stop them going forward, or to mitigate what we've seen, what we're currently dealing with?
Sure. So one of the one of the hard things about being part of the infectious disease community that does a lot of surveillance of these pandemics before they ever emerge is that there's just never enough resources and attention being given to mitigating against this threat before it ever gets out there, because when nothing is happening, we're complacent as a population, right? And so once the threat emerges, then everybody's like, well, wait, why weren't we better prepared? And why isn't everybody, reinforced with what they need to contain it? Well, we didn't succeed in containing it because we weren't proactively prepared. What we should have had in place from the previous epidemics was knowledge that inevitably, not if, but when another infectious disease was going to emerge, that there should have been a protocol in place, and a lot of these resources that we're now scrapping to try and get a handle on and to mass produce. Those are the kinds of things that we should have had in place, and what we should have learned from previous outbreaks. We can use that knowledge going forward, because this isn't disease X. COVID-19 is a serious disease. I'm not saying it's not a risk to the population of the planet, but there will be a disease that emerges, again, not if, but when. And we need to have learned from this and really make sure that we have everything in place, because how are we expecting people to do their jobs otherwise?
That's right.
Thank you so much. I really appreciate your insight and your expertise as well. All right, well, many